Hi, I am going to speak about neglect syndrome. This neglect syndrome is otherwise called as spatial neglect, hemi-neglect, hemispatial neglect, contralateral neglect, unilateral neglect. Some of these types can be subtypes also for the previous neglect syndrome, what we have mentioned already. Damage to the right parietal lobe due to any causes, it may be head injury or stroke or any other ischemic kind of injuries. Damage to the right parietal lobe or lesion to the right parietal lobe can cause this neglect syndrome. Results of the patients completely ignoring the left side of their own world, even the left side of their body itself, they will be completely ignoring. Patients will be eating only the food on the right side of their plate, show the right side of their face, or they will wash the right side of their body. They'll try to, when you give some food, they'll try to eat only the right side of the plate, the food which is present at the right side of the plate. They will not concentrate on the left side. They'll when they try to groom themselves, they'll try to shave to their right side only, not to the left side. They won't concentrate on that. And when they are taking bath, they'll wash only their right side, not to their left side. And people may be thinking that previously people will be thinking that this may be a problem with blindness. People they might have lost their eyesight, vision, or something. But actually, this is not blindness. This is a problem of attention. This is a problem in attention. Most commonly observed in stroke patients or any accident victims, which they are undergone the traumatic brain injury. This can sometimes occur after similar damage to the left parietal also, but this will be much less frequently and with a milder form. Okay. Then there are few types of hemi-neglect. One is sensory hemi-neglect, that may be because of visual neglect or tactile neglect or auditory neglect. It means the visual may be affected, because of that heminegligence may be occurring. Tactile sensation may be affected, because of that negligence may occur. Auditory sensation will be affected, I mean they cannot be able to hear, so that the sensory neglect may be occurring. Then motor intentional neglect. The term says motor intentional. That means due to pain or due to lack of usage, the people try to protect their limbs because of the spasticity or some other thing, any other thing. They will try to protect the uh, limbs without making any movements. So because of that, that may be producing the negligence, and that is volunteer. So that they say is this motor intentional neglect. Then combination of sensory and motor neglect. Then the conceptual neglect. The last one, the conceptual neglect, that will be so interesting and which we are going to see now. There are three types of conceptual neglect. One is anosognosia, second one is anosodiaphoria, third one is hemiasomatognosia, in which the hemiasomatognosia, the patients completely deny their left side of the body, which is the part of them. Anosognosia will be so interesting. There will be lack of awareness of the hemi neglect itself, which will come to this later. Anosodiaphoria, that means they are really aware of the disability. They know what exactly they are suffering from, what exactly they are going through, but there will not be any connection between the emotional concern or the the emotional things or the association area, so that they will be aware of doing that particular movement, and which they can be using that particular area, particular left side of the body. They cannot do that. So that is called anosodiaphoria. And in anosognosia, they will be having heminegligence, and important thing here is they will be having heminegligence and They don't know that they are having heminegligence. Even they are not at all aware of that they are having heminegligence. This can be also seen in Wernicke's area which is affected, so that they will be having Wernicke's aphasia and frontal lobe dysfunctions. In these kinds also, in these situations also, the patients will be having this kind of anosognosia. Okay, for example, I'm going to give some examples. See this one. She is intentionally refusing to see or concentrate on the left side. This, for example, and we cannot understand what's exactly through this simple picture. But let's see to the next one. See, when we ask the patient to copy a particular clock, we draw a clock and we ask the patient to draw the same type of clock, and they will be drawing only to the right side. They are not able to draw on the left side, and they are not able to mark on the left side. The same way, we are asking the patient to draw a flower. They will be marking nicely and drawing nicely to the right side, and they will not draw to the left side. The same way, any picture or something. This is about copying a picture. Suppose, for example, if you are asking the patient to draw spontaneously anything, you draw something like a wall plug or something you draw. Like that, if you are asking, they will be drawing only to the right side. They intentionally neglect to the left side. The same way, when they are trying to draw any table or any face or any car or something, they draw perfectly to the right side, and they will not be nice to the left side, and they will neglect certain areas in the left side, or they will be incomplete in the left side. Okay. This is about spontaneous drawing and copying. This is very useful in analyzing or assessing the patients with hemianasognosia. The same way, can you see, if we are asking the patient to draw a cube, they are complete with the right side and they are not able to complete in the left side. The same way, if we ask the patient to mark certain stars or mark into marks, cross marks, they will be marking only to the right side and not to the left side. So this is about hemianosognosia or hemi-neglect. Okay. Uh, this one we can see it in patients with stroke, sometimes very rarely in Parkinsonism also, and mainly we can see this in stroke or traumatic brain injury we can see. Thank you.